Welcome to Beyond the Data. I'm Dr. Phoebe Thorpe, and here with me today is Dr. Mike Frazier from ASTO. Thank you for joining us.
Sure thing. Thanks for having me.
Today's session was about using data to protect women and infants. CDC is a data-driven agency. We use data to tell us about where problems are, even like in the day-to-day public health challenges, but also during public health emergencies. How was data used during the Zika outbreak to help women and children?
Yeah, there's lots of ways data were used. Data and surveillance are a core public health function, and CDC is obviously the premier institution, organization in the country that does public health surveillance and data work with states and territorial health departments. Data were used in Zika in lots of different ways. First, there was the way data were used to learn about Zika. We didn't know a lot about it. And over time, we learned about its transmission and who was more at risk and things like that using data. But we also, in addition to clinical data, learned a lot about communities and what the burden of Zika was in a place. And we also used data on the environment. So a lot of things people forget, as the mosquitoes live somewhere, we had to monitor them. Look at some of the risk factors in communities and use those data to address the health challenges of Zika.
So this is what happened before too. In emergencies, we spool up and collect more data and surveillance information. And states did that for the Zika. And now it sounds like they're leveraging it to track other public health emergencies and threats. Can you tell me some about what states are doing with that?
Sure. Our history has really been recently to create new surveillance systems, new data collection systems for emerging threats or existing threats. So we had H1N1 in 2009. We had the Ebola scare. And with Zika, certainly there have been new specific surveillance systems created to monitor it. And our response has really been in these emergencies to create new systems. One of the things that states and territories are really interested in doing is thinking, how can we sustain some of these systems so that over time we can add to them instead of recreating them? And that's going to be a challenge for us because right now our states all operate differently and the resources for those surveillance systems come from different places.
Yes. And you hit on a very important point because it's collecting the data. It's got to be timely. It's got to be what they say is the right data at the right time.
Right.
So tell me, what have states done to collect the right data at the right time?
Yeah, this is a real issue for us because you want to use these data to make decisions. You can't wait years to get the reports back. And so a lot of it has been thinking about what are data that are already being collected and how can we use those. There's computer-based systems potentially. And then also, it sounds weird, but go with the standard that might be less than perfect. So what are some good sources of data versus the perfect sources of data? And when you start with that approach, you start thinking about, okay, there's other sources we can get more real-time. Emergency department data. Those are collected pretty real time, right? Sure. So some of these surveillance systems where they're looking for the exact or the perfect answer, that's going to take a little bit of time. But there are some real-time indicators that folks can use for decision making, and I think we saw some of that in Zika. We're starting to see a lot of it with the opioid crisis.
Sort of the 80% solution.
Right.
Yeah.
Hopefully a little more than that. But close.
Yeah, of course. But collecting data, sometimes there's challenges. Can you tell me about some of the challenges and what we're trying to do to overcome them? Sure.
There's lots of challenges to collecting data. I think people think, oh, I'll just fill out this form or input these data on a website. And in fact, it's not that easy. First, patients have to be willing to share the data and recall and know the answers to the questions you're asking them. The clinicians have to have the time to enter the data when you're asking a busy clinical office to add data to a report or send extra data to the health department. That can be a burden. They're already rushed. And then there's the whole challenge of cleaning the data and making sure it makes sense. So I remember back in the day when we were collecting data on the anthrax emergency and anthrax outbreaks, we were faxing clinical reports back to CDC and the health departments. And unfortunately, that's still the case in a lot of places. So we've got a ways to go in increasing our surveillance capacity and making that faster and better.
Faster and better and usable.
Right.
Yeah.
Right.
So the states are going to try to build on the Zika surveillance systems. What will we get from that?
I think what you'll see is a lot more integration. You'll see this concept of systems being used for multiple conditions. One of the things we're really interested in is the national surveillance strategy that CDC just recently launched. And I think that's a great document to explore how can we do things better, how can we do them, collect data in a more timely way, and what do states need to participate in that. And I think we'll see a consolidation. Right now, I think there's over 100 different surveillance systems that states report to that come to the CDC. And it creates a lot of legacy systems, and probably there's a lot of efficiency that could be realized in combining some of those. So I think we'll see in the future a platform that can be used for multiple kinds of events. There's differences between an infectious disease when you're maybe looking at laboratory data from other kinds of emergencies, counting mosquitoes or something. So we have to be sensitive to that. There's not a one-size-fits-all approach, especially about something we're still learning like Zika. But I think we'll see a lot more standardization potentially and consolidation over time.
Good, good. Sounds excellent. If somebody was interested in learning more, where would they go? Where could they find out more?
Sure. Well, I think specifically if they're interested in Zika and some of the birth defect surveillance work that's going on, cdc.gov/birth defects would be a great place to go. If they're interested in what states are doing, feel free to Google your state health department and/or ASTHO, ASTHO.org.
Okay. All right. Thank you so much for joining us.
You're welcome. Thank you.
And thank you so much for joining us. See you next time on Beyond the Data.